Hello, ladies and gentlemen. Thank you very much for joining us today here in this valuable webinar on understanding the causes and natural treatments for, nocturnal urination. Or we could say, to help frequent urination, excessive urination, urgent urination. We're all in this category. The result is that you end up urinating when you're not supposed to be urinating in the evening. So I really named the webinar based on the symptom that is most annoying for people, and that is urinating at night. But in fact, we're going to cover the many different causes of this, excess and frequent urination. So if you have such a condition where you're getting up at night to urinate, then first thing you need to do is to classify it, just like I would with a patient. First, I have to categorize them in understanding what is the cause. Why is this person getting up at night to urinate? So there's many causes, as you see. And then once we know the cause, then we can begin the path of treatment. And even when we have a cause, as per Ayurveda, we could have different types too. So there's many variations here. And this is what's very important in any type of treatment, is actually the diagnosis. There's no such thing as, what do I take for my nighttime urination? Now you could just say, oh, take some nettle, take some urva, ursi, and you may be successful. But this is a kind of shoot from the hip approach, and may be incorrect diagnosis and not get results. This is why sometimes we hear about people saying, oh, I tried that, I tried this herb, oh, herbs don't work. It wasn't the herb that was the problem, more than likely, but it wasn't the right treatment or herb for your cause, what you were doing to cause it. So this is what's very important. And of course, we're just going to use layman's terms like nighttime urination, frequent urination, and we can avoid medical terms. In Ayurvedic terminology, we're talking about the kidney, bladder, urinary tract system. Mutra, Vaha, Sotra. Sotra is system. Mutra is the urinary system. So we're talking about the urinary system. And as per Ayurveda, every system can have 4 types of imbalances. One, where it's excess, where it's going too fast. Even your mind system can be going too fast. Even your colon system can be going too fast, and you have diarrhea, loose stools. So that's one imbalance that can take place in any system, including this urinary system, is this excess. The system's moving too fast. Frequent urination, in this case, you're running to the toilet every hour instead of every 4 or 5 hours. And then also there's what's called a blockage, or sangha, which just means the system is congested, not completely blocked, but it's congested. Which we could say in the colon, that would be like constipation. And we can also have this in the urinary system, where you're going to the toilet, but it's not all coming out. You got the dribbling, men have the shaking, you're trying, and then you're going back to the toilet again because it didn't all come out. So it's a completely different cause of this, system. It's now being congested. So it's still creating this, you have to get up at night to urinate, but it's a different reason. Big difference between overactive bladder and a kind of congested kidney bladder system. And then there's also an inflamed bladder or urinary tract, or the whole system can be inflamed. There's more pain, there's more burning. There could be even prostate would be in this category. Urinary tract infection is in this category. A bladder infection is in this category. Usually there's pain and stinging and burning feeling for this category. And then we have other causes as well, including diabetes, high blood sugar. This is a cause, a little outside the scope of what we're talking about, but in that case, you need to treat the blood sugar, the diabetes, and then the urination issue will resolve on its own. So there's no point to treat the excess urination when there's high blood sugar, because you need to treat the blood sugar. That's the cause. And also there's a, like a lack of control of the bladder. Kind of the bladder isn't able to hold it. Incontinence, where the bladder is just not inflamed, not, congested per se, but just it's not holding the water. So this is another cause. So the three we're going to talk about today, let's review. First, the overactivated or overactive or stimulated urinary system. What's this coming from? Coffee, anxiety. You get nervous, anxious, you urinate. Like, it's very common. If somebody holds a gun to your head, a lot of people just urinate. They're so nervous, the body urinates. But, if you're an anxious person, you're having anxiety in your lives, everything is panicking you and worrying you, then you can create this. The nervous system can stimulate the urinary system, and you have this frequent urination. But coffee is the most common stimulant that people are taking that's dehydrating them. It's a diuretic. In fact, many diuretics could do this too. Sometimes medication itself can create this condition, but that's kind of outside of the scope of our talk today. So stimulated urinary system, that's one category. So if you're in that category, you're having frequent urinations. You're going to the toilet maybe every hour, even every 2 hours. Every 2 hours, that's still like 12 times a day. Women have smaller bladder than men, so maybe 5-6 times the most in a day. Men, larger bladder, can go 3-4 times a day. And of course, if it's hot, you're sweating a lot, you're going to lose a lot of water through the body, and you're going to go less. So this is the first category you want to see if you're in, is this overstimulated urinary system. And then, of course, you have to remove coffee and other stimulants. Even you stimulate your nervous system with chocolate, stimulating drinks, then you're going to have this frequent urination where you're urinating too much, the bladder's overstimulated, and then you will end up going at night. The next category we talked about was like congestive. Now, this is very different. You still end up going a lot during the day, but the flow is not very good. There's more dripping, there's kind of more effort to get the urination to start, and it stops before you're completed. So then you end up going back again to the toilet, but it's not much coming out. And this can be, many things can create congestion in the kidney, bladder, urinary tract pathway. We're just talking about the whole pathway. And remember, this is not a medical approach. This is an Ayurvedic approach. So in a way, we don't really mind what's blocking it. All we know is it's being blocked, because there's different types of kidney stones, which we can talk about in a different webinar that I have on managing kidney stones. But first, we just have to know, is it overstimulated or is it congested? So that you can tell by your own flow of your urine. And then overstimulated, a lot of times people are just drinking water, and then 30 minutes later, they're running to the toilet, comes right out. Seems like the whole bottle comes out of water, and their skin remains dry. This is like you're not digesting the water. Every system has a digestive part to it, agni, that's able to digest the water. And when you drink water and you keep urinating it out and you're dry and you're urinating a lot, you're not digesting the water. So we'll talk about things to help you digest the liquids and not urinate it out. But the third category, and you need to know if you're in this one, is inflammation. And then you can have inflammation in the urinary tract. You can have inflammation in the bladder. You can have inflammation in the kidneys. But particularly in the bladder, in the urethra, you can get pain. You can have pain. You can feel it in the kidneys area. And when you urinate, you feel stinging and pain and burning sensation. Not just pain, but a little burning and stinging. And of course, it's maybe not a urinary tract infection per se, but feels like one. And sometimes people think, I got a urinary tract infection, but they go get tested. There's no infection. But that's inflammation in there. And now, of course, an infection would create inflammation too. So if you're getting a lot of urinary tract infections, you're having stinging, burning while you urinate, then you're in that category, in an inflamed system, pitta. And if you have a lot of frequent urination with good flow, but just going all the time, then it's a vata conditions, overactive. And if you have blockage where you're having dripping and poor flow, then this is kapha, congestion, sangha, restricted flow. So first you want to get in one of these three categories. And the other three categories, which we're really not going to cover, would be diabetes, lack of bladder control, and inflammation of the prostate. These other conditions as well can contribute to this nighttime urination, but we already have three that we're going to deal with today. So I think it's enough. So now let's talk about what we can do for each of these three and how we can improve it. Now let's start with the vata one, overstimulated. This is the one we should easiest to treat because it's connected a lot of times to the nervous system. Like I said, when you get nervous, you can urinate more. So this type of person, we want to remove all coffee, all stimulants, chocolate, even cacao. It's stimulating, and sugar, white sugar. Didn't say you can still have bananas and dates and even cane sugar, but not white processed sugar. It's too stimulating to the nervous system. And definitely no coffee, no green tea, no black tea, nothing with caffeine in it. You have to drop the stimulation down. I'm surprised how many people are urinating at night and still having coffee in the day and haven't picked up on the connection yet. But there is a big connection. Just because you had it in the day doesn't mean it's not affecting you in the evening. That caffeine stays in your body for a few days. So we have herbs for this, but first we need to get rid of the causes. Now, if you have inflammation in the urinary tract, then you want to avoid hot foods, spicy foods, even sour foods. Like vinegar is going to make it worse. Chili pepper is going to make it worse. Tomato sauce, acidic foods, nightshades, tomatoes, eggplant. These are acidic foods, making an acidic nature and creating more inflammation and pain. As we know, people with any type of inflammatory condition, including arthritis, people find relief by getting off the nightshades. So if you're having inflammation in the bladder or inflammation in the urinary tract, and you feel that burning, painful sensation, then you want to reduce inflammatory foods. Again, sugar is not only stimulating, it's inflammatory. So you want to take white sugar out. Doesn't mean you can't eat bananas. And you also want to take out all citrus, all sour foods. Vinegar, lemons, limes, pickles, all are going to make this condition worse. And a lot of times heat will aggravate this inflammatory condition. So hot spices, chili pepper, cayenne pepper, even too much ginger can do this. Now, turmeric is from ginger family. They're in the same family. So if you take a little bit, it's all right because it's not as heating as ginger. But you take a lot of turmeric, it's heating. So don't think that turmeric will be necessarily a cure for this condition. Even though it is got anti-inflammatory properties, it can be heating, particularly if a person says they feel heat or burning sensation in their bladder. It actually feels hot. And I've heard this before. So here we have to treat the person with cooling foods, cucumber juice, celery juice, cilantro, coconut water, melons. Bring down the heat and take away the inflammatory foods like nightshades, tomatoes. Okay, so that's the second category. Third category is congestion. That means there's something blocking. It could be one of the many types of kidney stones. But you can just have a kind of congested kidneys that are not processing your water very well and not moving it to the bladder very quickly. And like I said, in Ayurveda, we don't need to know precisely what's happening. We just need to know the function that's not working. See, in Western medicine, they want to know things at a cellular level. And in Ayurveda, they don't need to know things at a cellular or even a detailed level. They just need to know the functionality. What function It's not working. In this case, when you're getting up at night and urinating, that's a function of your urinary system that's not working. Now we're breaking it down into categories and understanding why it's not working. So when there's congestion, usually we have stronger herbs, stronger substances that start breaking up this congestion, like shilajit and other herbs. We have a formula called chandraprava, and this is helping to flush out and cleanse the kidneys and dissolve even kidney stones, so and get the flow going again. And in fact, a lot of times we don't even have to know what's blocking it. Sometimes there's this blockage where the people say clearly, I go to urinate, not much is coming out. It's dripping, and I go back an hour later, and it just feels like I'm never getting a full urination. We technically don't really have to know what's blocking it. All we know is we're going to flush it out, open it up, clean it out, and we know the herbs that will do this job. And we know there's no burning, no pain, no stinging, so there's no inflammation. So we just categorize it in this category of being congested. And it's very easy to notice because you don't have very good flow. And once you start taking the herbs, things, your urine starts flowing, and you have bigger, complete urinations in the day. And then at night, you slowly stop urinating. So I've been very successful with this treatment. Well, there's many variations of this treatment, and have used, as you can see, I have many testimonials about people, mostly women, who have thanked me for helping them to resolve this condition. And before we get on to covering the herbs, I want to emphasize that this is a more serious condition than people think. People think, well, I'm just getting up 2-3 times a night to urinate. Now, some of you may be getting up 5-6 times a night to urinate. But even one time at night to urinate is very unhealthy. You've disturbed your own sleep pattern. You've maybe taken away your own deep sleep. That just getting up that one time. The next day, you're going to be a little fatigued, and you're going to be more tempted to do stimulants and coffee, which can make the situation worse. And also, your immunity will become weaker and weaker. Years of not sleeping through the night, you become weaker and weaker and much more susceptible to infection. So, and you become more fatigued over time. And also, there's a lot of metabolic processes that take place, particularly within the liver, creating hormones and managing lipids and things like this, that if you keep getting up 3 or 4 times at night, the liver, kind of like our janitorial service, it kind of comes in at night and does a little cleanup while we're sleeping, is not able to do their job. It's like at night, there's certain activities that take place in our body that are cleansing, detoxifying, that need to take place. And when you keep getting up, these don't take place. So then you can have other health complications. But the real one that gets people the most is the fatigue and the low immunity and the weakness that builds up in just weeks of getting up at night to urinate. Unfortunately, people become accustomed to it, don't think it's that serious, and ignore it and just live with it, and it never seems to get better. I've had clients where they were going once or twice. They said, don't worry about it. They come back and see me 5 years later, and now it's 4 times and 5 times. It just seems to slowly increase. So you want to get it in the early stages and treat it early, and then make some small changes to the diet, like I suggested here for one of those 3 types. And then you can take care of this issue in a matter of weeks. This is not like a long treatment. You're going to have to take herbs for months and months. Usually it's a matter of weeks. You do this type of treatment and you get results, and the urination at night starts going down, and at the most over a couple months. And then when you're not urinating at night, then you're good. And sometimes it reoccurs 2-3 years later that people start urinating again at night. They call me, I send them the same herbs again. They take a little $35 worth of herbs, and they can resolve the situation quickly because they're catching it in the early stages. So mostly we're using herbs for this treatment. We have a different herbs. We'll start with Western herbs first. One of the most famous herbs used, of course, for Um, no nettle over there, guys. Um, is nettle, which is coming. And another one here. This is horsetail. Horsetail is a diuretic, big diuretic, and helps flush the kidneys, and is also a very cooling herb. And the most important herb, if you were to only take one herb to kind of help support your kidneys, would be nettle. Nettle is another diuretic and used a lot of times for kidney issues, and also helps with the adrenals. And then, of course, if you have infection or burning or pain or urinary tract infection, urva ursi, a fantastic herb for urinary tract infections. And for blockages and kidney stones, we use gravel root. And it's amazing. It's like these little roots are like rocks, hard. You can't even grind them up in a coffee grinder. That just will break the bone. So it's really hard root called gravel root, and it dissolves kidney stones. Amazing. And sometimes we supplement that with other herbs, like parsley is also a nice diuretic, which is used in a lot of Western formulas. And then tribulus, which we also is used both in Indian and Western and Chinese formulas. And tribulus, called gokshura in Sanskrit, used by Indians as well. It's also called puncture thorn. You can see it right there. It's like a little, look at that. It's like a thorn. It's amazing. But it's a key herb in Ayurveda for improving kidney function. And we use it particularly in kidney failure. So here's our first tea we're going to talk about, and a combination of these herbs works well. And yes, nettle's a slightly stimulating herb and light and dry and can increase vata, but we don't just take a nettle by itself. Here's our first formula, which we use, kidney support formula. It improves weak kidneys, improves the function, increases urinary flow, and reduces swelling. Swelling, another symptom of urinary tract blockages. So you're not urinating well, plus you have swelling. This is a sign of blockages. There you see, first ingredients, nettle, parsley, horsetail, tribulus, also called gokshura, and a little urva ursi, not much urva ursi. And you can see the instructions in the day on the bottom. Drink in the day, drink warm in large cup, strain before drinking. So this tea should be drank in a large cup, and it should be taken on an empty stomach between meals, because it's a very strong diuretic and helps flush out the kidneys. And right away, just 1 cup in the morning and you're urinating like a horse in the afternoon. Now, then is like variations now of that. That's what we call kidney support. We give the same tea out for kidney failure, just different supportive herbs. It's in fact the carrier for the herbs. It's carrying by drinking it in a large cup and in between meals, and kind of quickly, we're forcing the herbs, or not say forcing, guiding the herbs down to the urinary tract system. If we just sip it slowly like a tea, then we'll absorb it in our tissue and we won't urinate it out. So that's why we put it in a big cup and we drink it kind of quickly. And then the next thing, 30 minutes later, we have to go to the toilet. And even in 1 cup, you can notice that your urination flow has increased. And if you take that every day for 3 or 4 days, if you have a mild case, say you're just getting up at night to urinate 1 time, and it's like late, like 4 or 5 in the morning, just that alone will do the trick. 1 bag, 1-2 cups a day, 2 or 3 weeks at the most, and you'll probably been enough to flush out that kidney. But that's for a mild case. If you have confirmed have kidney stones, which are easy to see, a lot of chiropractors have x-ray machines, and when they take a x-ray of your spine, they see the little stars in your kidney area, and they know you have kidney stones. And they're very painful, they burn, they apparently they hurt so bad it's comparable with childbirth. Now, I haven't given birth to children nor had kidney stones, but this is what people say. And of course, I have clients who just were passing the stones the day before and then come see me, and they give me the details of how painful it is. Peeing out crystallized, hard, stone-like substances. Now, we'll have another webinar on kidney stones, and there's many types of kidney stones. So you have to know which type of kidney stone you have, which is best, and then we can make some modifications to the diet. But one of the things that do create kidney stones is a lot of supplements, calcium supplements, magnesium supplements. These synthetic supplements are known to produce a type of kidney stone. And a lot of people, their first sign when they get kidney stones or pain in their kidneys is after starting taking some vitamins. These cheap vitamins, they're low quality, not food-based vitamins, and they start taking this calcium, magnesium, synthetic vitamin, and then they start feeling pain right away in their kidneys. Now, of course, the kidneys were probably already, being blocked, over time, but then that synthetic supplements were the straw that broke the camel's back, and then they had the pain. Very common. Fortunately, we got a tea here, kidney stone tea. Breaks down kidney stones, flushes out the kidneys, increases urinary flow. There's nettle again as the base. Gokshura, which is really, the key herb in Indian herbalism. And there's gravel root, which I showed you, that really hard one. That's the one that dissolves the stones. And then horsetail, diuretic. And then a marshmallow root or slippery elm, that's just to give some relief as the stone passes. These are demulcent herbs that will line the urinary tract. So when the stone does pass, it will pass a little quicker and won't be as painful. Now, I've had people that ran off to the hospital with kidney stones. They got painkillers there and not much else. And they came back, and then they did an appointment with me, and they were getting this, stones. You could urinate in a cup, and you can see like a little sand on the bottom of the cup. And every time they're urinating, it's painful. They took just the tea sometimes and drinking it every day. Once you've had the stones, you really drink it a lot. You really feel like drinking it. And we give dietary guidelines as well. And they said that was it, 2-3 bags of that, and they feel their stones were dissolved. Even though we have, depending on the severity of the case, we would add more herbs on top. This is just the teas that we'd use as the base, as the carrier. So here's the next one, a very effective tea I've been selling for decades, UTI tea. Relieves urinary tract and bladder infections, increases the urinary flow, and reduces swelling as well. There's nettle again, the first ingredient, but there's ursi, which is fighting the infection. And then horsetail, diuretic, little juniper berry, also good for infection, and slippery elm and wild white oak, which is an astringent herb and helps bring form to the bladder and kind of tighten it up and help with that loss of bladder control. So we put an astringent herb in there for that lack of bladder control, which is another tea. So you can see that it's very similar, these ingredients, we're just changing them based on the cause. And of course, we do have a prostate tea as well for the men. And you can see still the first ingredient is nettle. Second ingredient is still gokshura. But now we have, sassafras, saw palmetto, and there's horsetail as well. So you can see some of the similar diuretics are there that are in the tea. So, one of these teas is going to be chosen for every client that's coming with this problem. So that's the first objective, classify what the cause is. Then I will pick one of these teas. Next, and if it's a minor case and it's not so serious, maybe just the tea will be enough, particularly the urinary tract infection tea. This tends to be enough. Most women only do about half of this bag, and the urinary tract infection is gone. And sometimes they've had it for 2-3 weeks and they can't get rid of it. They tried cranberry juice. I keep hearing about cranberry juice, but it doesn't seem to be working well, because a lot of people are coming to me saying they're drinking cranberry juice and they still have it. When they start drinking this tea, you can feel relief the same day. In fact, I've had women pounding on my door. Bam, bam, bam. What's going on? Thought I was going to be raided. Bam, bam, bam. What's happening? And I open it up. This woman says, "Oh, I need your UTI tea." I had it more than once. People showing up at night looking for my UTI tea because they had it before and they knew the results were there.
and they wanted to get it as fast as they could. So now we got some more. Now once you got the we call anupana, the carrier, the liquid, and we need a liquid when we're taking herbs for the kidney, because we need it to go in a liquid form so it reaches this whole pathway. So the tea and the herbs go through the bladder, the kidney, the bladder, and the urinary tract. We need them to go through this pathway, because as they're going through the pathway, then the herbs are absorbing through the tissue and treating the condition. So again, if we just sip it or take it with a little water, it won't work. It has to be with a lot of water, and we have to drink it kind of quickly and urinate it out and keep doing that. Now, generally, then we add other herbs to this tea to make it more effective. So here we use an Indian herbs, and this is, we call it it's like a kidney cleanse, detox. We call it kidney cleanse formula. This one is for kapha and vata, reduces urinary blockage, swelling, and resolves nocturnal urination. There's gokshura again, and this is a formula Chandraprabha. Chandraprabha is actually a formula with 26 herbs in it, and it's used all by itself a lot of times for urinary tract infections and urinary blockages. It's a traditional Indian formula. It's been around for thousands of years and is used for urinary tract infections, urinary blockages. It has shilajit in it, gokshura, and 24 other herbs because they had similar problems in the past. But here we've made this a little bit more suitable for the kapha vata prakriti by punarnava, diuretic, varuna, which is a really wonderful herb for clearing and opening the whole pathway, opening it right up. In fact, if there's a lot of blockage, I had one case where, clearly the woman said it was a blockage, it wasn't inflamed, so I added extra varuna to it. It's a very strong diuretic, and there's a little shilajit too, which is in there, and you may know shilajit. And there's some shilajit in Chandraprabha. Chandra means cooling, so it's a cooling version because shilajit's a little hot. Now, if they're heavy person, kapha person, a lot of extra weight, big blockage, and there's possibly kidney stones, then I may include this as well. And that's pure shilajit. We call it mineral energy tabs. It's organic shilajit right there. So I may add that as an extra. So if you were a big person and you had a lot of blockage, and you had kidney stones confirmed, I may give you all three of these right here. See, this would be your treatment. You drink the tea, make the tea, put a teaspoon of the kidney detox in the tea, and drink that 2 times a day between meals, and then take 2 shilajit twice a day with meals. Now, if they didn't have stones and there was just blockage, I can do the same thing with the kidney support tea and this formula. Okay? Now, if there's inflammation, like burning, pain, stinging, we have a different formula for that. Any burning. Once they mention burning one time, that's it. I don't want to use that shilajit because that shilajit could make the burning worse. We have this one right here. And it's also called kidney cleanse formula, but pitta. Pitta means fire. This reduces urinary burning and urgency and resolves nocturnal urination, just a different cause. There's gokshura again, there's Chandraprabha, but now we have sandalwood. Sandalwood is very cooling and clearing. Instead of shilajit, we're using sandalwood. And mustatu is an anti-inflammatory cooling herb used to bring down inflammation. Now, if there's a lot of inflammation in the person's body, it's either joint pain, muscle pain, they're very inflamed, I may combine it with anti-inflammatory. Now, this is very powerful anti-inflammatory. It reduces systemic inflammation in the body. And we're using boswellia extract, which, if you don't know, is frankincense. There's some amlaki, and then there's some little pipali, which is a long pepper. It's a little sweeter than the black pepper. Turmeric, just a little bit, and curcumin extract. So there's curcumin. It's very effective at bringing down inflammation in the whole body. It's very fast, much more effective than just turmeric, which you can't take much of. It's too heating. Curcumin by itself isn't complete. And we find pretty much frankincense extract, or shilajit, shilaki, as we call it, is more effective than even curcumin. But we combine it together. We put them all together. Frankincense extract, turmeric extract, and then we put a little amlaki, an anti-inflammatory, and a little pipili. We use pipili instead of black pepper because black pepper is too heating. So if a person has a lot of burning, a lot of pain, inflammation in the body, we may give them these two right there. And if it's due to prostate, they can take it in the prostate tea. If it's not due, if they're a woman and it's not due to prostate, we may just give them the kidney support tea and then put 1 teaspoon of the kidney detox in it, and then take this anti-inflammatory 2 or 3 times a day. You're getting very fast results from this type of treatment. Inflammation in the whole body reduces, and we see swelling will go down, inflammation will go down, the flow in the day will increase, the amount of urinations in the day will reduce, and then ultimately the sign that you're having, that you're making progress is, of course, then the urination at night reduces. It doesn't go quickly. People are going 5 times a night. They may do 1 jar, 1 bag, come back and say, well, I'm down to 2. And I say, well, that's halfway there. And I just give them another jar, another bag, usually 2 bags in 1 jar. And they do it again for another 3 or 4 weeks. And that can resolve it. Now, when we talk kidney failure, we do use different herbs there. And this also, so if we have kidney failure, we have this renal cure. And this is what we're using when people actually are scheduled for dialysis and they have kidney failure. We give them the kidney support tea with the renal cure formula together as much as 3 times a day. And of course, the diet is very strict in this case, and it's another subject. Treating kidney failure. But you can see on my website, I have some testimonials from people who had high creatine levels, kidney was failing, scheduled for a dialysis, and through proper diet, because the diet's very strict for kidney failure, and these herbs, they were able to improve the flow of the kidneys, lower the creatine levels, and not have to do dialysis. So these herbs are very effective in supporting the kidney, and there's very few things that do support the kidneys. Unfortunately, all medications and synthetic vitamins will be harmful to the kidneys. So anybody taking any vitamins at all in almost any kidney condition, particularly kidney failure, I tell them stop all supplements. And a lot of times, some of these supplements were the cause of the person's problem in the first place. Too much synthetic supplements. And of course, there's many medications that can damage your kidneys. And most of my case who have kidney failure, they have the failure because they had to take a medication for 20 years, 30 years, and then it damaged their kidneys. And even the doctor will tell them you have a kidney failure due to these 2 medications that you've been taking for over 30 years. So it becomes more complex because you have to help resolve these other medical conditions first before you're able to treat the kidneys, because the cause is the medication. So you may have to help the person with the blood pressure first, or the diabetes first, before you're able to help address the kidneys, which can take some time for them to recover. Slowly and gently is always a better approach than a fast approach. So again, I want to hope that people see that there's many different causes to nocturnal urination, and they should identify what is their cause, and you should try to eliminate the causes as much as you can. And drinking water at night is not the cause. By not drinking water at night, you didn't get rid of the problem. Many people say, well, I urinate at night, but if I don't drink after 5 p.m., then I'm okay. Well, you didn't solve the problem, and this person is very dry and dehydrated. It's dry skin, dry mouth, maybe dry colon, and they're getting constipated from this dryness and dehydrating all their organs, creating more health problems. So, eliminating water doesn't solve the problem. Just like if you can't digest certain foods, like, I can't eat dairy, I can't have wheat. Well, just stopping the dairy, stopping the wheat doesn't resolve your digestive problem. If you can't eat a piece of bread, you have a digestive problem. Once you improve your digestion, you can eat a little bread again, you can have dairy again. It may or may not be good for you to have too much dairy or bread, depending on your health issues and your weight, of course, or many factors, but you should be able to do it. And just eliminating these foods isn't a treatment. And the same for water. If you're urinating at night, not drinking water isn't the treatment. You've just actually could be making it worse, because you actually need the liquid going through there to avoid further inflammation, further congestion, and further blockage in the system. So, and just taking diuretics or having coffee, even though this is making you urinate, can also make the condition worse. So there is hope. It's not difficult to treat. You can see from my website, I have many testimonials of people, mostly women, thanking me for not having to get up at night to urinate. Now, I would like to quote my dear mother here, who's 85 and 85, I'm sorry, Mom, and listening to this webinar. And if she could text in, I'm sure she would, but she's on a phone. And I've heard her say that she speaks to women all the time, younger than her, 20 years younger, because she's 85. So she's speaking to women in their 60s who are getting up 2-3 times a night, and they say, oh, it's normal, it's normal, it's normal. And my mother replies, no, it's not normal. I'm 20 years older than you. I don't get up at night to urinate. And most of my cases are elderly women in their 60s and their 70s who are getting up at night to urinate. And unfortunately, people think it's normal. It's not normal. It's still not a good health sign. You may be able to function and stay alive, but doesn't mean it's normal. It's like a car mechanic looking at a car, and he looks underneath the car and he sees all this water dripping under there. And he says to the person, no, you got a problem with the car. And they're going, nah, it's fine. I just tap it up with water every few weeks. But, that's not a good sign, dripping water out of there. So it's the same. You could create other complications, other problems if a car, if it keeps losing water. And it really needs to be taken care of. And same with this type of excess urination, frequent urination, inability of the bladder to hold the urine. And of course, the result of urinating at night, keeping you up at night, disturbing your sleep, and affecting your overall health and immunity. This is not natural. This is not the way your body should be functioning. So if you're having this nighttime urination, then you can't say that you're completely healthy, because this is a problem with your urinary system. And I encourage you to make some changes to your diet and lifestyle, and maybe try some of these teas on your own. And then if you're not successful, then contact me, and I will help you to resolve this condition naturally, so you can sleep through the night again. So thank you once again, ladies and gentlemen, and feel free to contact me if you have any interest or have any questions about how to resolve this condition naturally, and I'll be happy to speak to you about your individual case. Thank you.